Greetings. Let us learn about plastic stents used during ERCP. So when it comes to stents, they could be straight stents, double pigtail stents, or single pigtail stents. And these are all made of plastic. And these plastic stents come in different sizes. The single pigtail stents can come between 3 French to 5 French, and straight stents and double pigtail stents come 7 French, 10 French, and some can be a little bit bigger than that. 3 French is about 1 millimeter. And in addition to plastic stents, ERCP experts use metal stents. And these metal stents are 8 millimeters to 10 millimeters that are deployed into the bile duct. So let us learn about the role of plastic stents that are placed into the bile duct. And once you remove the stones from the common bile duct, if the patient is waiting to have surgery for a few weeks for removal of the gallbladder, you may want to put a plastic stent to prevent the stones from dropping down. So one indication is a patient with stone disease. Another indication for plastic stents is after you perform cholecystectomy. If there were to be any bile leak, that could be managed by placing a plastic stent which prevents the bile leak and allows the leak to heal. So another indication is bile leak. Patients who have a stricture of the bile duct, either a postoperative stricture following cholecystectomy or a malignant stricture causing biliary obstruction, you want to drain the bile duct, you can place a stent above the obstruction and manage that stricture. So these are all the different indications for placing a stent into the bile duct: stone disease, leaks, and strictures. One could also place a plastic stent into the pancreatic duct to manage patients with chronic pancreatitis if they have a pseudocyst or if they have a pancreatic duct leak. In addition, if there were to be some difficulty in performing ERCP and you're worried about the risk of post-ERCP pancreatitis, and in those cases, sometimes endoscopists place a stent into the pancreatic duct as a prophylaxis or prevention against developing post-ERCP pancreatitis. So here we placed a stent into the chronic pancreatitis because of a stricture. So in summary, plastic stents can be used for a variety of indications: stone disease, leaks, strictures, and pancreatitis, either prevention of pancreatitis or management of chronic pancreatitis complications, either strictures after removing stones from the pancreas, pancreatic pseudocysts, pancreatic ascites. When it comes to the adverse events of plastic stents can migrate, occlude, or once they occlude, they can predispose to cholangitis. How about the adverse events of plastic stents when you place them into the pancreatic duct? Again, migration, occlusion, and if you leave them alone for a long time, and if the patient doesn't come for removal of a pancreatic stent, they can develop pancreatic ductal changes, similar to what we see in patients with chronic pancreatitis. So it's very important to keep a note and make sure that the pancreatic stent has either dropped out on its own into the duodenum and has gone out, or we should bring them back and remove the pancreatic stents. I hope this is useful. Thank you.